Yo, yo, yo. Hey, guys, welcome back to another awesome edition of the Best Practices Show podcast. One of the hottest topics in all of dentistry is airway. And have you ever asked the question, how do I make airway profitable in my dental practice? Well, I have somebody who has the answer. Her name is Dr. Tracey Nguyễn. Not only is she a very cool person, but she's a brilliant educator. And that's the topic of our podcast today. And she shares some very revealing things about her journey and how you can apply them to your practice. So listen up. I know you guys will enjoy it, and we'll see you soon. Hey guys, welcome back to the Best Practices Show podcast. You know the jam here. I love this thing so much. This is so much fun. I get to hang out with amazing rock stars that are changing the world of dentistry, and we get to learn what they're up to, what's going on, how to think better about a dental practice, and some of the new, things that are out there, like airway. And today I have one of the greatest rock stars in dentistry, Tracey Nguyễn, and we're going to be talking about how to make airway profitable. Have you ever thought about that? Everybody's thinking about that with Dr. Tracey Nguyễn. Tracey, thanks for being on.
Thanks for having me. Thank you.
Oh my gosh. You're one of the busiest people in the world. You're like everywhere. You're doing the coolest stuff. And so whenever you schedule, I'm like, oh my gosh, this is awesome. So now.
You got to do it. You got to keep the message strong,
Absolutely.
Someone asked me the other day, because I think at the beginning of the year, it's only been like the second, third month. I was like traveling literally every weekend. They're like, do you like it? I was like, I don't like it, but I feel like I have to do it. It's one of those, like, I have to get that message across. You got to keep going, pushing through.
You are amazing. And so, I've seen you shine on so many levels, and I've seen a ton of your stuff. You showed up for us in the COVID conference. And I think what you're doing is so powerful. We have a lot of young listeners and new listeners. If they've never heard of Tracey Nguyễn, I want you to tell them who you are. Share with them your story a little bit, and we'll start there. How's that?
Oh, gosh. Well, I'm just a simple gal. I guess I started off in my journey just trying to be like hardcore, strong restorative dentist, just trying to be a really good restorative dentist. And then I went into the AACD, got accredited. And then when I did that, I decided that I wanted to go like fee for service. I was like, yeah, I'm really good now. I can do all this stuff, and people would pay to see me. Well, I learned really quickly that was not true. And I was like, wait a minute, I'm accredited by the American Academy of Cosmetic Dentistry. I've done course, and what? You still don't want to see? You still want to know if I take your insurance? But it's interesting because I pretty much at that point decided to reinvent myself. Like, okay, who is Tracey Nguyễn? Like, what kind of dentistry does she want to practice? What kind of office does she want to have? And in that journey, was pretty much how I kind of got into airway and just understanding people, their overall health, and just I felt like dentists had a bigger purpose. And I think once I started to speak on my purpose, that patients kind of got it, and they saw me differently. I wasn't like this badass cosmetic dentist trying to charge this amount. They saw me as like a person that really cared about them. So that's kind of like what my practice is right now. And the money will come. It's funny, when I first started this, I had one assistant who's no longer with me, which probably should have been a sign. But she said, Dr. Tracey, how are we going to make money? We're not making any money here. And it's very true. Like, to start off, there's so many tips that I have that I would tell you not to do. But and we're doing great now. But it's definitely a learning curve. But I think with anything is, you learn from people that have already made the mistakes, and you don't make the mistakes. You know what I'm saying? Like,
Oh, Tracey, did I lose you?
I lost you for a second there. I think we
Hey, I
got cut
lost
off.
you. Yeah. So don't worry. We'll keep going. It just lagged for a little bit. So my
Yeah,
editors
it's
will
all
take
good.
that out and you won't even notice it. So cool, cool, cool. Um, okay. So share with everybody, where do you practice?
Oh, I'm in Northern Virginia, right outside DC. I have
Okay.
to say Northern Virginia because when I say Virginia, everyone thinks I'm like Virginia Beach, South.
Right.
So I'm where all the crazy politics is,
Yeah.
right outside DC. Yeah.
Yeah. So, and I asked you before you hit the go button, like, what you spoke in Charleston recently on this topic,
Yes.
like how
Yes.
to make Airway profitable. Let's start with the basics. So you went in, you use a couple words that I love. You find out your why and your passion and like your purpose. And I think
Yeah.
that's probably a big part of it. But then also, can you speak to the reality of like not making money when you chase that? Because that does happen to all of us, right?
Yeah. Well, I think the big thing that people don't get is airway dentistry is not, it's, you don't take a course and you're going to come out making a lot of money from that one course. It's not like implant dentistry or like something where, or a composite course where you're learning an actual skill and then you're going to practice it Monday morning. Airway dentistry is more of, think about it as like an occlusion course, more of like a philosophy course. And just like occlusion, there are several different camps, and you have to kind of decide what you jive with more, what fits your philosophy. So I always tell people that comprehensive dentistry is airway dentistry. It's not different. Like, and I think there people try to overcomplicate airway dentistry. It's like you're still doing dentistry. Don't try, like, if someone has an airway problem and they don't believe you, and there's all this dentistry to be done, don't spend 2 hours convincing them they have an airway problem. Just do
Right.
the dentistry, And I think that's the big thing that a lot of dentists forget. Like we forget to be dentists first. The whole thing with airway dentistry is just understand that there's an airway component and understand that your dentistry could potentially make it worse. So don't make it worse.
Right.
It seems like so simple. It's like we definitely kind of overcomplicate what airway dentistry is.
Yeah, absolutely. And then I would imagine bringing your team with you. You mentioned your assistant. Like that's a big component of all of the business part of it, right?
Yes. So one of the things I mentioned, in my How to Make Airway Profitable is like you're not going to do it without your team's blessing. Like we all know this. We go to a course, we come back, and they just think that okay, they just took a weekend course, and my dentist is going to be gung ho for 2 weeks, and then it's going to trickle away. The thing with airway dentistry, it's such an emotional impact for you, your significant other, your children, that your team needs to see that. And most likely, someone in your team is suffering from it. Someone in your team knows someone that's suffering from it. So once the team has a why for themselves, then they can support your why.
Right. Right. That is so powerful. And I want to ask you about your extended team too. So your team isn't always in your office.
Yeah.
I get this question all the time. You don't understand. I'm in an area where myofunctional therapists and orthodontists and other people that understand this are limited. What do you say when you hear those questions?
I remember being with Rick Robley at a meeting, and he said, if you can't find your team, make it yourself. Like if you
Mm,
can't find these people, then you develop your team. So basically, as a restorative doctor, so I'm one of those doctors that I don't spread the wealth. I have a very strong referral network. That person, that specialist, basically gets all of my patients. I have 2 periodontists, 2 oral surgeons, and those people we have a really great connection with. So my referrals, I mean, common sense, kind of like you don't bite off the hand that feeds you, right? So
right.
like, and so those are the ones who are going to listen to you more, respect you a little bit more. The ones that aren't buying in, don't waste your time.
Right.
They'll come when they're ready. And I think that's the thing that we struggle with. Like we want certain people on our team, but if they're not ready, they're not ready. So then you find someone else that's willing to listen, and then you grow them. You grow together as a team.
Yeah.
Um, that's how I kind of pretty much developed my network. I sent out an email to all of my best referrals, and I said, "Hey guys, this is what I'm seeing that's happening. This is where I see dentistry, and I need you to support me on this." And like
That's
they were all on board. They're like, "Tracey, what do you need us to do?" Yeah.
That is awesome. So you're going to build your core of the people that you're going to build on. And so go back to that. You were talking about your referrals. Can you just mention, so if I were to ask you, like, how do you get patients coming to you? Do most of them come through a referral network of other specialists, or are they referred by other patients? I mean, what kind of a pattern are you seeing now just on the basic business end of new patients?
So for me, social media has been I have a love-hate with social media, but
Really?
social media
Wait. Okay, you have to explain that.
yeah, but social media has pretty much built my entire platform. Because like when I think about when I was kind of discovering myself and discovering my why, I was like, wow, there's not that much information about this. And so I decided well, I'm going to put it out there. I made all my social media pages public. I started blogging about literature reviews. I would basically post a literature blog, post a case blog on social media. And then I just started to get known. People were like messaging me, "Hey, I just
Right.
read this." And then they started kind of connecting with me as, the airway specialist or airway dentist. And then just being real on social media. Most of my patients do find me from that. I get a lot of referrals actually from other dentists and other medical colleagues. I get referrals from other medical colleagues because I developed my own group locally. And like I said, like you grow it yourself. You basically figure out you from the medical side, you ask your patients who their doctors are. And then you say, well, I'd love to connect with them. And then you have your patients connect to you because that's the common core there is your patients. And then from there, that's how I got it. I mean, my average new patient commute is probably about 2 to 4 hours.
Wow.
Yeah. And so like, I mean, I just had someone fly in from like Ohio. So it's interesting because like the thing is with Airway, I mean, some of these patients, they're desperate for answers, and like, and they just want someone to listen to them and they want to know like, is it their anatomy? What else can I do? So yeah, I mean, it's been really good. I mean, it's interesting because like my practice now, like and I'm still learning how to structure it because while I'm a heavy restorative practice, the new patient worth for restorative practice is you get this patient as a new patient and you get X amount every year. That's the cost of this new patient because you're going to see them every year.
Right.
As a specialist, you got one treatment and then they go back. So I'm still kind of learning that, So like with my team, it's like, all right, guys, I need more new patients than a GP because I got one shot with one treatment.
Right.
So it's a learning curve. I'm learning things differently and how to communicate with patients. So
Yeah.
it's not.
What comes to mind? What was your top two learning points? Like, oh, I learned this because I
Yeah.
could do an hour-long show on the things I learned the hard way. But go back to
So
like your top two or top three things you learned.
so what I will tell anybody if they're doing Airway, what you should not do is do not give your patients homework.
Whoa.
And this is what I did, and I realized, why am I doing that? I'm supposed to be the expert in this. So do not have all these books in your waiting area and say you should read this book. Do not give your patients books. Do not give your patient places things to read because you're supposed to be the expert. You look in their mouth, you're supposed to know what's going on or suspect what's going on and direct them to the right care.
Right.
And so I told an analogy would be like, as a restorative doctor, we ultimately decide the restorative material we want to use,
Right.
right? So, but we don't go, I just came from like an Ivoclar lecture and I'm going to use this type of composite. I'm going to give you the MSDS on these 3 types of composite. Can you go home and research which one you want me to use for you Monday morning? Like it makes no sense, right? But we do that with Airway. We're like, you know what? We think you have a breathing problem. We think you have this. Here's some articles that you can read, and here's some literature reviews that you can read. No,
Right.
patients don't want that. And so my number one thing is do not give the patient homework. You have to be very confident in what you are seeing and how you think that this patient should be treated. And it's okay to say that we're going to get to put together a team and figure out how to treat you, because that's how we do interdisciplinary care with regular dentistry. We have to do it the exact same way. Once you give someone homework, you become less confident and less knowledgeable in the topic.
Wow. Did you find, can I ask you about that? Did you find they didn't do the homework to begin with, and or they kind of lost confidence or energy in the treatment? I'm sure there were some findings in there, as you were asking people.
Yeah, well, what ended up happening is I used to always be like, yeah, we read this book, read this and that, and then I'm like, they're gone.
Yeah.
Then the ultimate goal that I was like, well, what is my goal in this treatment? What do I want the patient to do? And that's the key here. It's like, if you don't know what you want the patient to do, then if you give them something, you're just opening up a can of worms that makes it very confusing for them.
Yeah.
It's just like saying, you have a cracked tooth. I don't know how I want to fix it yet, but let's read up on some materials.
I would go somewhere else, I guess,
Right. So, and that's what, because people always ask me, where should I learn all this? It's like, again, I can't tell you like where, if you can afford the time and the money, you should learn from everyone.
Yeah.
But at the end of the day, if you're going to make recommendations in treatment, know what you're recommending. If you are giving people homework, then you don't know what you're recommending.
Yeah.
And that makes you look less of an authority, and there's going to be lack of confidence from a patient standpoint.
Yeah, that is so good. That is so good. Here, quick show. I'll take this out at 15:4. This is awesome, but every time you touch the table, it echoes.
Oh,
So, don't worry, I'll take that out. Because you'll hear just a couple times, because you're getting fired up now, and I love it. It's awesome. So cool. Okay, so that was number one. Number two, what's another learning when you look back? Is there anything else you'd say? Don't do this.
I think I do like social media.
Okay.
And I think that you have to decide who's going to do that social media for you. I definitely think that you want to be careful about oversharing. But I think that patients do look for social media for content. So, I mean, that's pretty much how I got started with it.
Yeah.
Finding people, they search for you based on that.
Okay, so can I ask you, do you do your own social media, or you found somebody that you could give it to? And then what is oversharing? I don't know what oversharing is. What is that?
Yeah. So, I think, so I do it myself, and it's very exhausting.
Okay.
But I think when you do it yourself, it's very real and it's very organic. And patients connect with that. Patients know when it's not you. Oversharing is almost like, you gotta understand how you're going to be perceived too. So there's certain things you don't want to do, and
Like
that's arguably
personal
up for
stuff?
debate. Yeah,
Yeah, like, oh my
arguably
gosh.
always up for debate.
Oh
But it's
yeah.
funny because like I post a lot of like. I mix up my social media with workout stuff, and I always wonder, I'm like, I wonder what my patients feel about me showing my workout videos. But I think they like it. I mean, I had a guy in the office the other day. He's like, Tracey, how much are you benching now? And I was like, so it was cute. But I think social media can be good and bad. Bad in the sense that it can really mess with your psyche, with the whole like likes, do they like me? I mean, the more popular you get, you're also going to get people that don't like you.
Mm-hmm.
And I think I think every once in a while I'll come across a negative review or a negative post, and it just hits you to the core.
Yeah.
So you just have to kind of remember that when you put yourself out there, you're going to take the good and the bad.
Yeah.
And that's
Very
why I
well
say I
said.
have a love-hate relationship with, like, I love it because I feel like I have a stronger reach. I hate it because every once in a while I get a really bad review and it really strikes me to the core, but I just have to kind of bounce back up. I mean, like there was one lady, she was searching for answers for her son. I think she probably has like 1 million followers. Like she posted this long thing about how she didn't realize her son had an airway problem and how a dentist caught it. So she reached out to me because she wanted me to continue treating her son. But it's amazing. Like she had like 1 million plus followers. And when you grab these people, or it can do wonders for your practice. So I do like social media. You just have to know how to do it.
Yeah,
You know,
absolutely.
and that's
It's,
a whole lecture in itself, right?
oh my gosh. Well, that'll be our next podcast because I don't have a
Yeah.
clue. And so maybe you can help us with that. So you did ask me to ask this question before we hit the go button. I love it. Is like, how long did it take to make, a profit in this journey of yours? How much you want to share about that? I'd love to know your thoughts on that.
So I got accredited in 2015, and that was like my first drop.
Right.
It probably took me about 2 to 3 years to get back up again.
Right.
So I will say with anyone that's debating on dropping insurances, um, don't expect, just expect the worst, but it's going to be fine. Like tough it out. Figure out your why and make sure the entire offices understands your why, because that's gonna keep you going.
Yeah.
Like I think like when I went down, I was like, wow, like it was like, what, people don't love me? Like what is this all about? They care if I take their insurance? Like, but the insurance game is so messy right now. I mean, like now, today more than ever, like when I dropped, insurance, patients weren't getting letters saying, well, you spent, 4,000 with Dr. Nguyen, you could have saved 4,000 with Dr. Bruno next door. Like it's insane what the insurance companies can say now. So it's actually in their statement, like you could save $3,000 if you stayed in network. So it is so important for the entire office to be able to answer those questions, and just stay on course, because it's really rewarding when you feel like you're getting paid your worth.
Yeah, absolutely. And I agree with you. It's crazy what they can do now and we can't do at all. And it just is what it is. And I think as a team, we've got to be more calibrated on what to say, how to create value, and we have to be able to stick to our guns because the reimbursements aren't going up in dentistry. A recent expert that we met with shared that the average write-off, do you know what the average write-off is in dentistry? I didn't know this.
Probably 70.
No, what's the average write-off for a practice that heavily participates in PPOs? It's 42%. Like that makes it makes no, and climbing because of all of the shared agreements and all of those things that are happening. So I think if you're going to do high quality dentistry, you have to do it from a values centered standpoint. And you have to, because most of the things you worry about don't happen. You're like, my practice is going to die. No, it's not. It's going to be a struggle, but you learn things. Didn't you, as you did this, I'm sure you and your team learned a lot. You're like, whoa, So
it did. Like, I mean, we basically, we had to kind of like regroup and be like, okay, guys, what do we stand by? What do we believe in? And we have to stick by that.
Yeah. And so can I ask you, like, what was your journey for insurance? Do you participate at all now, or you do not? And so how long did it take? Were you fully participating at the beginning and now you're not?
So I bought a practice in 2000, I think about 2005, and it took about 2 or 3 insurance. I think it was like Emeritus, MetLife, Delta, and then I slowly started dropping them. Like every 2-3 years, I would drop something. When I dropped Emeritus and MetLife, it was really easy because the compensation was almost the same. It was like a no-brainer. So I didn't think it would be a big deal for me to drop Delta. Because I was always going up when I dropped insurance. I was doing less, still going up. But the problem with Delta, the compensation is like ridiculous. I mean, like where a patient would pay $200 staying in network, they now have to pay $1,200 with me. So a family of 4, I mean, I understand that's a huge consideration that they have to think about. $1,200 versus 2. So you just got to stay the course and and decide how you want to practice. I mean, if you're going to take the insurance, you have to be, you have to be okay with taking that cut. I mean, I just decided that like I'm worth more and I'm just going to get paid more and I'm okay with like taking less,
Yeah. What's really fun
seeing
is
less.
absolutely. What's really fun is a lot of dentists that take this journey, they go, well, I'm just ready. And they say, whatever happens, happens. And then they always say, it's crazy. I'm making more money and I'm not racing from operatory to operatory. And
Yeah.
it totally messes with your mind because you thought the opposite would happen. You thought you'd be sitting around, no one would
Yep.
come in, and it would be hard to grow a practice. But there are dentists, young ones, that are like, I'm still too busy. There's still too many people coming.
Yeah.
So you're going to be okay. And there are very few dentists that get off of any of those and fail. I mean, I can't even think of the last one that got off and said, yeah, my practice died. I'm like, I haven't heard that story in many, many years. So I don't know.
Yeah. I heard John Coy saying that like, the he's getting a lot of new grads come to his course. And
Mhm.
that's very new because like John's course is like $10,000, you know? And so to be like, so I think what's happening, we're seeing a generation of dentists, young dentists that want to really deliver quality dentistry and want to go fee for service. And then we have some that are, you know, just, and there's nothing wrong with it, jumping into like the DSOs because like they're in so much debt. Like I get it. I mean, I was in that when I first came out, I worked for a huge HMO practice. But I just realized I just didn't want to practice that way. It was kind of just like in and out, in and out, in and out.
Yeah.
I didn't like it,
Yeah.
but it
And
taught me how to be fast.
I totally agree. So I do meet dentists and they're like, I'm embarrassed to tell you this. And I'm like, why? And I'm like, well, there's so many good things you're going to learn. You're going to learn speed, efficiency. You're also going
Yeah.
to learn what you like and don't like. It'll strengthen your resolve for the next 30 years of your career. And wouldn't you agree, in your late 20s or early 30s, at least for me, you don't really know who you are yet. You're just starting
No,
to learn who you are.
you're,
So I think before you build a practice, you got to kind of figure out who you are, right?
yeah, absolutely. Like the office that I worked with when I came out, what I loved about them is there was 3 doctors in there, and one of them was a prosthodontist. So while I was getting paid pennies, I learned a lot as a dentist, and I think that's very valuable. You know, it's like that growth and having that mentorship, someone teaching me a little bit about the business, and then discovering like what kind of dentist you want to be. Because I don't think you really know until you start diving into it. And you're
Right.
like, okay, I don't know if I like this. I like this, you know, and then you just figure it out.
Yeah. Can I ask you on the, I have so many questions. We could easily make this a 2-hour podcast on the profitability side. So I understand your journey up until this point, but like mix of services, fees, do most dentists just overthink this? Because going back to what you said a little bit earlier, you're just basically, am I simplifying it too much by saying you are a great restorative dentist and Airway now is just a stronger component of the treatment? And if so, like, how do you incorporate fees around that component? What do you say when people bring you that question?
So from an airway dentistry component, like you're doing more dentistry.
Right.
So like that fee it's not really like an increase in fee. It's like you're just doing more dentistry. You're looking at these arches, you're rounding out the arches, you're doing more bondings, and you know you're doing comprehensive dentistry to try to not make the airway worse. So that as a whole, you're just doing more dentistry. Now, there are other procedures that you can add in your wheelhouse. So one of the things is orthodontics, Invisalign. Most people are already doing Invisalign. Well, from now you're setting it up for restorative. Now you're setting it up to make the airway better. You're increasing the oral volume space for the tongue. I'm doing Invisalign on younger kids, so you're catching them a lot younger. So that's like an extra tool that I'm doing. Um, Laser therapy treatments. So I was already doing lasers, crown lengthenings, and soft tissue, hard tissue. Now I'm looking at frenectomies, you know, tongue ties. I'm looking at the soft palate, like night lays. So there are definitely extra procedures that you can do that are that pertain to airway to add into your wheelhouse
Yeah.
for
So
sure.
Dr. Mark Murphy, good friend of all of ours, every time I ask him a question, he goes, you go back to the principles. Your fees are not really about the procedure. It's about your, care, skill, and judgment in the amount of time. Would you agree with that? I mean, I
Yeah.
love that. And, is that applicable here?
Yes. I mean, because like you think about like when you take an inclusion course, you don't I mean, when you come from John's course, when you're doing comprehensive dentistry, now you're looking at this one tooth that's cracked and you ask yourself why. And you
Mhm.
look at the whole mouth as a whole. Like, is there a loss of vertical? Is it constricted? Occlusal dysfunction. So you're opening up these bites. So you're trying to rehabilitate patients' mouths now. You're going away from single tooth dentistry and being like overall comprehensive care. And I think that's the goal with occlusion courses, and that's the goal with Airway. It's comprehensive care. Get away from single tooth dentistry, even get away from quadrant dentistry, like do the entire arch. How does it's crazy because I had a case the other day, and this patient had like 8 veneers, and he's got this crazy deep bite, and the veneers lasted for 20 years until that deep bite, not anymore. So one tooth broke, and so he was like, what am I going to do? It's like, I got to fix your entire bite. This is not as simple as just redoing your veneers.
Yeah.
And that's the key is, I think, when we take any of these large comprehensive classes at Coyce or Spear, we're trying to take a step back from single tooth dentistry and then go into comprehensive care, because that's where the money is. It's how much you treatment plan, and you're not doing it obviously for the money, but you're being more comprehensive in your care, and
Yeah.
it just comes with it.
Gosh, I have so many questions, and then we'll save them for future episodes. But one of the questions I have today, it's so cool to watch you write the book of your story. Every chapter has this new adventure. I gotta ask, like, what can we expect on the horizon from you? I know you're always thinking about cool. Like, what's in the next chapter for you? Anything come to mind?
It's interesting. So my focus was always, when I started, it was a lot of kids. So everyone knows me as like the pediatric person, which is funny because some people mistaken me as a pediatric dentist. And I was like, no, I'm a restorative doctor. But what I hope to, what I hope to do in the next 5 years is to make thinking about looking at airway dentistry more mainstream and try to uncomplicate it. I was talking to John Coyce the other day, and I said, it's just way too complicated. We need to stick to dentistry. I mean, yes, there are other factors. Yes, maybe some of these people need myofunctional therapy, maybe even need some body work, whatever. But we need to really stick to dentistry. Just look at airway management as comprehensive care and stick to dentistry. So what I hope you'll see more in my lecture material is I'm going to be taking adult cases and saying, hey, you're already doing it. This is what's happening. So I had a talk with a Coyce clinical instructor. She said, Tracey, can you send me literature on increasing the vertical? I need to know if I'm making the airway worse. And so then I go through all the talks. I was like, well, it could get worse if you have this kind of anatomy. It'd probably get better if you have this kind of anatomy based on the airway. And she says, oh, I get it. I said, see, you've already been doing airway dentistry. You just made the patient better, And so my goal is trying to really clean that up a little bit, because I don't think most people get it. They think it's a whole different discipline, and it's not.
Right.
The goal is just to don't make it worse. You're already doing it. But just give you little tips on how you're doing it and the why behind it.
Yeah, so well said. So well said. I want you to talk about some of the things that you do as far as lectures, but before we do that, any last thoughts on profitability and airway that you would share?
I think that, like any occlusion course, the profitability comes. It's more about the dentistry that you start treatment planning. So don't think of it as a course. I just took an implant course. I'm gonna place 5 implants. It's not an immediate relief like that. It's basically changing your mindset. Think of it as an occlusion course, and it eventually will, as you start to see more of it, as you start treatment planning these cases, the profit comes.
That's awesome.
The key is just knowing how to treatment plan these cases. And that's where I think that I'm going to take my next journey into like trying to educate on how to treatment plan these cases to make it more airway friendly.
Yeah, so well said. That is awesome. So I'll say to you as a listener, if you haven't had Tracey out to your study club, what are you thinking? Like, she is amazing, an incredible educator, extremely relatable. Like, you are so much fun to watch you do what you do. And so I'm going to encourage you. If I'm listening, I've never seen you speak, where can I find out more? How do I find out more about what you do? And share with them a few of the other causes that you have going on so I can check this out. Where do I go?
So my social media outlets it's at Dr. Tracey Nguyễn. So that's like Facebook, Instagram. I'm always posting stuff there. We have an online education program. It's called asappathway.com. And it's interesting because when we started, it was primarily for kids because ASAP stands for Airway, Sleep, and Pediatrics. But in the last couple of years, we kind of evolved to treating adult, like all ages. So now our courses are geared towards management of all patients. We do have a lot of like in-person courses, live courses now. Like next weekend, I'm heading to Vegas. So we're going to be doing a really big joint course, basically how to recognize children and adults with joint disease and how to make it practical. Because that's what it's, like I think the key, my message I want to bring home is like, we have to make it dentistry practical.
Yeah.
Because that's the only way we're going to do it. We can't, we're overcomplicating everything. Just make it practical and make it fun.
So well said. I'm going to have you back again and again and again, as long as you agree to, and just share great information. If you guys weren't taking notes today, don't worry. We're taking notes for you. You can actually flip up to the notes in Stitcher, iTunes, wherever you're listening to this podcast, and you're going to see links to all of Tracey's stuff right there. I'm going to encourage you to check it out. You'll enjoy it. She's an awesome educator. And Tracey, as always, I'm so grateful that you're on a regular basis. So thanks for being on. Really appreciate it.
Thank you for having me. I love it.
It's my pleasure. I get to learn from you. So stick around when we say goodbye to everybody else. But thank you guys for listening to the Best Practice Show. Hey, if you enjoyed today, please do us a favor. Share this episode with your friends because we love spreading the word to help others create a better practice and a better life. Keep sending us suggestions for things that you guys want to see. You're seeing that we're lining them up now, and I'll have Tracey back again. And anything you want to hear in respect to what she teaches, just let us know. We'll ask her the tough questions and get the answers straight from the experts. So until we see you guys again or you hear from us again, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.